want to save. Okay, let me just discard that, and let me turn on other one. Okay, okay, this is the blue screen again. What we need to do, okay, this is the one we want to share. We put it this one here. Where's that? Okay, hold on.
Recording is on.
Choose to share. Okay. Okay. Let's just go through the protocol, which in our agenda is there. We talk about that. Let me pull out the agenda. I'm pretty sure Michael emailed you the agenda. That's here. Can you see that? Yes, you can. Okay. Okay, let me make this bigger. Day 2. So we spend time talking about protocol, a little bit about the SOP, and we talk about amendment. We have questions. Then, okay, it's QA list. Okay, let's take a look the protocol, IR4 protocol first. Then we go back to the QA list. I know when I do training, a lot of places, a lot of people are interested in the inspection, for example. Sometimes the QA, sometimes the lab people, they want to get the prepared for the inspections. So we will go through this. Let's go to the protocol first. You can find IR4 protocol easily. You just type IR4 in the Google search. Then you will find IR4 project there. And the address is ir4project.org. Then you click food crop. You will find a database there. Then you just search. You just search any PR number. For example, in this case, you search this PR number, and you will be finding all those related protocol. I'm sure it's easy to use, easy to find, but you need to find to go to the right protocol. I'm sorry. I'm on the call, Ryan. Okay. That's this one. Yeah. Okay. Yeah, I'm sorry. Yeah, my son is standing beside me. That's okay. Sorry about that. Yeah. Okay. This on the screen you will see this IR4 protocol here, and it's, as I just mentioned, okay, it's gone. Can you close the door, please? Thank you. Sorry about that. Yeah. Okay. So you will see that this is the title. Okay, IR4 National Pesticides Clearance Protocol. In your case, you probably change that word in a different way, and you will see the chemical there and the crop there. Okay, so that's the one, and we said that in our presentation a few minutes ago. Make this is bigger for everyone to see clearly. So we got a title there. Then we have the objectives there. Okay, justification. So that is necessary there. And we all know the necessary thing is the GLP. Okay, so we go down a little bit. Does it say GLP here? Yes, it does say EPA. This is a guideline. No, that's not GLP. Let me go a little bit smaller. I'm pretty sure we can find GLP at the very, very beginning. So it must say the GLP at the very beginning. Otherwise, that will be a trouble. We got the sponsor here, okay? And we got the study director here. In this case is Thomas Pike, and that's in IR4 headquarters in Princeton, New Jersey. We got all those dates there. Remember, we put those dates. These are estimated dates. And remember, we used the EPA GLP, the definition. We got it there. We got experimental start date. What is this date? Do we know that? This date, start date, experiment start date is when you spray pesticides on that crop. So that is the start date. So what is the termination date? Experimental termination date. That is the last data collection date, which is your last LC-MS, MS injection and collecting the data. Once that's done, all the data is done. It's only process data. You also have all the paperwork related. That's it. Okay, so that is that part. And you will see study completion date. What is study completion date? We know that it's when this person signs on the final report. So we are using EPA GLP. That's why we can say, okay, this is all EPA GLP. If you use different GLP, that would be different. Then you have the signature. Of course, this is electronic copy. You don't see the paper copy, a signature here, but we do have the Thomas signature there. Oops, that's too far. Let's go back to the signature. Right after signature, what do we expect? We expect the GLP statement, okay? So we have some other thing here. Now it says 40 CFR 160. That's exactly the same. This is the same GLP. So yes, it is EPA GLP. Okay. So in this case, because we do a lot of work with Canada, the standard wording is we also make sure our work is compatible, is equivalent to, is mutually accepted by OECD GLP. So in this case, in Canada, they use OECD GLP. So you see, OECD, good laboratory practice, OECD GLP. So basically, when we do this work in the US, we make sure this is acceptable in Canada and acceptable in EU and other countries. And remember, when I talk about this something MAD, that means if you do the GLP work, those data can be mutually accepted. So MAD. So that means if you do the GLP work, your data should be accepted everywhere when they accept the GLP. So JMPR will accept that. Okay. And again, they talk about the GLP again. You see that. Keep talking about GLP. Keep talking about the GLP. Any deviation there, what do you need to do? Okay. Then, well, normally, because this is a protocol, we don't list the QA name there, but the QA must do the work. It's in the QA. I don't think we have QA name here. No, we don't. It's just saying this is a GLP. Okay. It does not say the QA name because our work, the study director or those people should not assign the QA job in the work, but the QA should put the statement there. Okay. So then we talk about test substance, which we call that in the lab standards. Then we will have other things like EPA, the registration number, all those things. I'm pretty sure that's somewhere here, but let's skip those things. Let's directly go to the laboratory because we work in the lab. Okay, there's a lot of field-related work. So we go to, I believe it's 20, exactly 20 number, 21, 22. That's the laboratory. Okay. This is the field, still the field. This is still the field. Okay. The shipment, sample shipment. Now it's between the field and the laboratory now. Okay, this 19 is there. So it's getting there. what we need to do, go back, keep going down to the laboratory. Can we see that? Okay, KL, okay. Field, keep going down, keep going down, keep going down, keep going down. When we see the lab, we stop. Okay, now we see the lab. We see the trials first. Okay, okay. So I know probably there's a little bit lag there on your screen. Still seeing residue sample handling shipment there. So let's just wait a little bit. It should be getting there right away, momentarily. Okay, and we will see the lab information, the trial information. Then we talk from there. Okay, so right now on the screen you should be able to see. Let me just make it a little bit smaller. You can see everything. Okay, so you will see there are 3 trials there. So one trial is in Florida. One trial is in, this PR stands for Puerto Rico. And one trial is in Hawaii. Okay. And you will see those 3 trials will be submitted to, the sample will be shipped to the lab, which go down a little bit here. We will see the lab. Okay. The lab is down here. You just wait a little bit. The lab is down here. That's a Florida lab. So it's here. So you will see that. Now, from now on, from 24, these are all lab, which we need to read carefully and make sure all the requirements are there. We understand, we follow the requirements. Okay. So this part, you see, you got the laboratory ID here. Okay, that's typical. It depends on your system. I'm sure in this mitigation work, we use the same pattern, same format, but in your own work, it may be a little bit different. So we will see this is the PR number. Okay, and we see this is the year 2020, and that's the lab location, Florida, Research Lab 03. Okay, so I'm sure if you are in, for example, in Vietnam, that will be VNR01 or something. And if you are in Singapore, it may be SG or something. If you are in other countries or different name, for example, Thailand will be, I'm not sure, it's a TH or T something. But depends on how we make use that abbreviation. Maybe in other places may be different. Okay, so it depends on the study director. It depends on your database. Okay, so let's go down to a little bit here. We're talking about sample now. Sample is in the field. It's coming to the laboratory. The next thing is the sample inventory. What do you get from the field? What's the sample inventory? Okay. So the next is how about the method? Okay. Oh, identification number. That's okay. We can keep going down. It's all going down. Okay. When you receive any sample, you don't mix them. Each sample is itself. Okay. So don't composite any samples there. And here it did say this is the protocol requirement. We were doing the exercise a few minutes ago. Is that right? When we talk about a sample extract. Okay, if you store the extract in a good location, in this case it's a refrigerator, 4 degrees. So 14 days is the holding time. So it's not exactly based on the science. It's based on the practice, based on Ir4 requirement. So 14 days. That's the sample extract. Okay. So now we start to see the beautiful wording here. Okay. Contact study director. We will see more and more in a few minutes, okay? That will be at least 12 I counted it's 14, but it could be more. It could be some other thing, okay? Okay, then the next is about the standard. So we need to get GLP certified standards. Okay, so it says clear enough. It's only GLP standard can be used. It says only. Okay, it means GLP requirement. GLP refers to the previous GLP we talked about. It's EPA GLP, which is equivalent to OECD GLP. Or other countries, specifically which countries GLP. Okay, then we talk about more. In this case, we talk about analytical method. Okay. So, and this method is here, okay? This is using the catcher's method to do that, to do the determination on phosphorus and the metabolite. Because this word, it's very difficult to remember such a long name. I typically just use the first 4, just the X117. This is what I say, but you use different way. It's easier for communication. If you use the words like sulfoxaflor, that's easy. But if you use X117194774, that's a little bit difficult. So I use X117, everyone understands. Or sometimes you say metabolite because sometimes you get more metabolite rather than just one. Okay. So, well, here the method says, okay, the protocol says, can you make the modification? Can you make the change? And what's the method validation? Okay, now we need to talk about the previous question that was just asked a few minutes ago. So what is the method? Okay, in this case, we have this called reference method. How much we can make the change. Now we have, depends on how much we make the definition, called that major and minor changes. Okay, so why we say that means a major means it's not acceptable, or you get special approval from each level to do that. Minor is a small part. So we will be talking the details on this later, but we just quickly go through this, make sure we understand exactly the same thing, because most Ir4 protocols are very similar, unless there's a special requirement. Okay. And what we say, the major, if you say you find anything major change, forget it. It will be so complicated to get approval from the higher level, especially study director, get approval from a registrant and the EPA. That's getting too complicated. Minor one, you still need to report to study director, but it's workable. So it says the method validation. Method validation says, okay, this is LLMV. Remember, we talked about that, LLMV. Now, because this method validation, that will be at least 3 here now. Then we will keep doing that. And we say minimum 6 LLMV here. Remember, we just asked the question, how many? I prefer 7, but requirement is minimum 6. Because 7 is easy to calculate when you do the standard student t-test. The coefficient is 3.14, which is easy number like a pi to remember. Okay, so it needs 6. In this case, minimum 3 times talking about LLMV and 6 LLMV level. Okay, so the typical, when you see this, we will see this one is the lowest one, and most likely because we are doing the mitigation work in this study, and we need to get to the detection limit to this as much as we can, because most likely it will be very low. So detection limit, LOQ, or lowest method validation level should be 0.01 in our work here. And we do 0.1 and 1, so we get very good range of the residue range in the work. Okay. And in most cases, sometimes we do see a little bit parent. That's typical, but metabolite most cases is low. So that's something we always see now. This is our general, that's common sense, scientific common sense. Okay, now we just count how many times we talk about the study director. How could we justify recovery more than 100%? Okay, the recovery range, acceptable range is 70 and 120. Well, if it is recovery, the question here is how could we justify recovery rate more than 100%? If it is in this range, okay, 70 and 120, okay, let's say between 100 and 120, in general, you do not need to justify to give any reason. Scientific reason is there. You have sample matrix, you have instrument fluctuation, and you have human error. But when you spike, you spike like 1 ppm, but for some reason the pipette is not good. You spiked 1.01, which is possible. Then your recovery, if you get everything perfect, you still get 101% recovery. But if you add those things together, it's possible to get more than 100%. So if it is between 100 and 120, most likely you do not need to mention, you just need to report. If your number, yes, the question is getting trickier. If your number is consistently 110, 120, 115, then you need to explain because you got something, you got very good precision, but your accuracy is away. So you need to explain why and how. It could be the matrix effect. I have more questions here. If 100% could happen. Yes, it happens all the time. We are all working in the laboratory. 100% is all the time because especially when you go down to lower level, any matrix effect will affect your recovery. It happens all the time. Sometimes you get 140, 130 easily because any kind of matrix there will contribute to the signal. So it happens all the time. Do we need to explain? If it is below 120, and this is once in a while, no, you do not need to. If this is consistently happening, you do need to. That means something is going on there. In your lab report, you need to mention something. If it is above 120, that's a big issue. So that's why the wording here comes again. Okay, you need to document all the approval from the study director. You need to talk to the study director. So it's the second time, third time now. But we don't track every single time, but I will say you will see this kind of a wording everywhere. Okay, could you please send me all presentation material? Yes, I will. Okay, the purpose I'm trying to delay sending to you guys the PowerPoint presentations. I want you at this time focusing on what I'm talking. Then after I'm talking, yes, I will send you the PowerPoint slides. Don't worry, you will get it. But it's just, I want you to learn first. A lot of people just, oh, it's on there. I have this anywhere. So that's how I teach at the university in those classes. I want to do this way. Okay, more questions for quality assurance. Mandatory. I will answer this later. This is more like a quality assurance QA thing. Okay. Yeah. Sorry about that, Sunil. Yeah, I'll talk about this later. Let me just finish what I must say first. Okay. Then you say, provide the study director something. Contact study director something. Study director needs to or may waive something. You see, these are all communication with study director. That's because we talk about the matrix effect. If it is higher than 120%, that's sometimes happen. Actually, most matrix effects should be matrix, not a matrix enhancement, should be depression, should be go a little bit lower. That's how we see that because it's an affect ionization in LC-MS, because once you have your sample into the ionization chamber, if you get too much sample matrix there, the iron source is so much. So for example, if you use a percentage, you have 100% iron source ions there, and your material occupies 50% of the ions, took them, and your matrix will take certain portion. So the ionization may not be that great. So most likely this will be ion suppression. You will not get 100% ionization on the sample itself. So that's, I will say, 90% chance the matrix effect is going down. Your recovery is low. But for something, they may help because it's easy to ionize. And the ions can be transferred to your sample as well. And this is called ionization is enhancement. This will give you consistently 130 or 140% recovery. It's not just one spike. It's consistently high. So that's matrix enhancement. It happens all the time. Okay, so we keep going down the analysis. Oh, we got more questions here. Oh, yeah, thanks, Michael. So I don't answer right now, but I will go through all of them later. Okay, now we talk about more now. We talk about sample analysis. Okay, now, well, we don't need to go through too much. We just need to say here, talk to the study director. If your analysis is not good, okay, if there's any change there, require study director approval, notify study director. Otherwise, that could be a deviation. Okay, so that's all those things. How many times now? 6 or 7 now. We're talking to study directors. Okay, so we keep going down. We keep going down here. Now we run any sets. Now we see again. Should be immediately notified. Study director should be immediately notified. So if anything is out of the range. So how many times now? I think it's 8 or 9. Okay. Well, I don't track that, but you can figure that out. But I'm just saying there's a lot of places there. Now there's another LLMV here. So, okay. So we know at least 3 times, I said. It's already more than 3 times now. Okay. So that's the one. Then we go down to storage stability. Go down to storage stability. Now here is something, it did say some special days there. So this is close to 2 years. This is a little bit background behind that because before we do any work, the company did this work and they have a lot of storage data. They graph the curve like this, and they typically do about 2 years. The range, make sure everything's okay. If it is in the freezer, negative 20 degrees, and the curve is like that. Okay, so in this case, they have the longest day, 680 days, 680 days, everything's good. So if in your lab, you keep the sample in freezer negative 20 degrees, so if you work within 2 years, you are fine because protocol allows you to do that. Of course, the sooner the better because the longer you wait, it could more things happening. How about your freezer fails? How about the spike is not good? Or how about something going wrong? The field still have time to do the work again. Otherwise, you wait 2 years, it's not possible to run it again. So that will affect the final submission. Okay, then we talk about more the statistical methods. Now, it does not give you exactly you must use, but it did say you use linearity there. So if you change it to different way, for example, it's not linear, you need to talk to the study director. You use the quadratic or other regression. That's okay. That's acceptable. But you need to talk to them. Make sure you report R squared value, not R value. Okay, and something. Okay, then we keep going down. And oops, that's too much. Okay, which is here. Then again, we talk about, oh yeah, here's a little bit. Okay, we talk about sample, how long you need to keep. Okay, so here it says for storage sample, assess sample here. Okay, normally is 3 to 5 years after the submission. So we keep 5 years in my lab in Michigan. We keep 5 years. So even after 5 years, we need to discard these samples. We still get approval from the study director. You see, it says here, okay, study director need to be contacted prior to discard the sample. Even we get tolerance, we get MRL established, EPA approved that. We still need to talk to the study director. Yeah, we have these samples we need to get rid of because our freezer space is limited. Okay, you can do it before that, but typically we keep it about 5 years. Okay, so that's another time talk to the study director. So anything change in the protocol or SOP, you need to talk to the study director. Again, talk to the study director. Talk to the study director. Okay, that's promptly. That means immediately. Don't wait. Okay, anything happens. Okay, it's better to make sure it's before this happens so study director can issue an amendment. Okay, even after it happens, study director can issue amendment or you file a deviation. Okay, this is how we do the work. Now it's just like a record keeping. Okay, so I don't need to go through that. Some of you already went through the study once in a while. I mean, 1 or 2 studies. You learned through your practice. That's good. But you can go through the list to make sure put a check sign there. You did that. Okay. I think we spent about 20 minutes on maybe longer than 20 minutes talk about the laboratory part of the protocol. And that's what you need to read carefully before you do any analysis. Okay, then when we go through, that's fine. Those are the archives. That's fine. Okay, any questions so far? If you have any question, put in the chat box so we can answer that. If I don't answer now, we can always save their questions and I will go over them and talk to you later. Okay, let's just minimize a little bit. What is that? The next one is let me pull out this. Okay, the QA list, checklist. Okay, do we have a question? Okay, no question. QA checklist. I think that's a Word file. Okay, let's see. Let me pull out this Word file. QA checklist. Interesting, I don't see it. Okay, actually it's a PDF file. Okay, now, I need to do that within 20 minutes so we can have some minutes, for questions. Okay, let's talk about the inspection. This is the checklist for the Ir4 project facility inspection. I know when I go to a lab, I typically use this list to go through what they have. Then I put in my the triple report. Then I have the certain sense how this lab is and how the work can be done there. For example, are they ready for GLP? Anything need to be improved for the work? Let's just quickly go through this checklist, and we will leave probably 10-15 minutes to have question session for everyone to ask question, and I can answer. If I cannot answer now, I don't have time to answer now, I can save the question and I will email the group later. If you want to send me email, that's fine. I will also respond to your email. If I cannot answer this week, for sure next week I will, because this week I need to get this down. I have other things going on in the same time. Okay, this is a facility inspection. Okay, make sure I see the chat box. Okay, in which case matrix match standard are used instead of solvent standard? I will give a little bit more explanation later, but I'm just saying this now because this is the question right now. First of all, it depends on the method. If you use a reference method, it does not require, it's specifically saying this is the solvent standard. Then you have to use solvent standard. You cannot change that. If you make the change, you need to get approval from the study director, from registrant, or even sometimes EPA is very picky on this thing. We had certain, well, don't take my word exactly, but we had a few occasions talking to EPA to change the calibration from solvent standards to matrix matching standards. We got approval from EPA and also get the good sign from the green sign from the registrant. The company say yes, this is a good way to go to offset, to minimize the matrix effect. For some methods which the company used many times and they worked very well, and they will give you the red stop sign. No, just use solvent standards. And even you talk to EPA will say no. So in this case, this thing is getting somewhere difficult to give you exactly the answer, yes or no at this time. If your method uses matrix matching standards, period, you are good to go. It's green, you are good to go. So this, because you are following the reference method, which is approved by the restaurant, by EPA, by the government agencies. So that's fine. And JMPR will accept that. Because this work, this mitigation work, most likely will be related to JMPR. And most likely, this will be accepted. So it depends on the situation. Talk to the study director. Make sure this is okay if your method does not allow you. So that's considered a sort of major change. So it depends. Talk to the study director. If you are the study director, talk to the registrant, talk to the agencies. Make sure this is in their acceptable range. Otherwise, when it's done, they will ask you a lot of questions why you do that. Even they approve that, they will ask you to show how you did method validation, why you match the matrix, why you do that. Because you will tell, if I don't use that, the recovery is consistently 60%, 55%. If I use that, I get 80% consistently. So EPA will accept if you have all the data, talk to the company, the pesticides company, talk to the government agencies, and make sure this is okay. So this is a big question. There's no answer yes or no at this point. So always talk to the study director, make sure this is okay. Okay, we talk about this list. We still have about 10-15 minutes. That's great. Well, we have the lab, the name. We have the QA who is doing the inspection there, and of course, You always have the date, and sometimes you have to sign here if you are the QA. And if necessary, if you need to do the reinspection because there are some issues need to be resolved, you put a date there. So you expect that. A lot of times, like in international, for example, I go some labs, I don't have this portion there because I don't expect to go to the same lab within like 3 weeks or a month. So I don't expect to go. Then I put there NA or not expected something there. Okay. There are some instructions there. And remember, this checklist is based on the EPA GLP. And all the terms you can find EPA GLP. And there are some short terms there, abbreviation there. We always use capital S, capital D for study director. Don't use the lowercase. Don't mix them because it's getting complicated when you do that. And also when you say the testing facility manager, some places call that FM. Sometimes call that TFM. So make sure you capitalize everything, TFM, make this way. It's easier, otherwise sometimes it's getting complicated. For example, if you use the lowercase SD, a lot of people will say, oh, this is standard deviation. Of course, we know in our work, this is a specific special term. We know this is study director. But make it easier for everyone. So yeah, we got something there. Let's see the questions there. And you will see there's yes, no, NA. NA stands for not applicable. That means it's not related to this. And you will see there are some asterisks there. That means this is a GLP requirement. So for example, GLP will not tell your lab how many square meters is good. It depends on your work, depends on instrumentation, and depends on the scientific common sense. Okay, if you only do one extraction and one analysis, one instrument, one GC there, I don't think you need 10 rooms for the work. So you have one or two. You have 2 rooms. One is for extraction, one is for analysis. That's good. It's size. Then you can check here, say yes. You can put it here, say yes. Okay, and okay, the working area. Typically, the standards and the extraction should be separated. Does not mean it's separated room. It can be the room, but separated place. If you make separate room, that's great. You prepare standards in one room, that's great. And you do the extraction in another room and do analysis in another room. That's good. If you can say this bench, this film hood is only for standards, that's good. Another one is only for extraction. Another bench is only for analysis in the same room. That's also good. As long as you specify the place, don't mix them because you may get contamination. So there are a lot of other things. Is it clean or not? Is it well maintained or not? This is all personal opinion. But the common sense is if you put all the glassware everywhere on the bench, that's not good. You can need to organize them. So it's about facility sanitation. That's different thing. So in this case, you can sometimes put NA. It depends. If you do the pesticides residue work, it's not that big issue. But you do the biology, microbiology, especially with current like disease or something, that's the issue. Okay. So yes, in this case, you need to be careful. So in our case, pesticides, it may not be a huge issue there. Okay, then we talk about another one, which is talk about the standards. In the EPA GLP, we call that test substance, or we call that reference substance. Okay, or sometimes we call that ARS. If you went through my training, I call that ARS stands for Analytical Reference Substance. And this is typical special term for EPA. For other GLP, they use different term, but we put everything there. Test substance, control substance, and reference substance. That covers, say that short. These are all standards. You work in the lab. Okay, you see this is GOP requirement. These are all GOP requirement. So you need to have a separate area for that. So you see, separate bench is fine. Separate bench, the fume hood is fine. Separate room is good, but same room you need to get specific place for this. Otherwise, because it's very easy to contaminate, and this is 100% or nearly 100%. Even a little bit, even the wind blow a little bit, it's gonna mess up a whole system. You know, LCM SMS is very, very sensitive. So then you need to talk about received and used. So every use you need to have a record. So most labs do, I know that. And this is about the test substance, the pure test substance. Some labs, even the stock solution has a record. Then that's good. That's even better. So then talk about the storage. Okay, limited access. Is it temperature control? For example, if your standards, most standards will say it's in dark and it's sealed and it's below 4 degrees Celsius. And do you have temperature monitoring? Make sure this is good, because once it's too high, it may be different. It's interesting. We put our standards, the pure standards, in the freezer. We have a special freezer, just a freezer for that. A lot of questions from the inspectors, from QA. It says 4 degrees and lower, why you put it in the freezer? So as long as you can control them, there's no contamination, there's no humidity inside your sample, that's fine. No condensation, that's fine. So it's better. Okay, then, okay, it's about the name, class number, batch number, everything should be labeled. For example, you have the vial standards, typically it's 0.1 gram. And do you have all the information there on that? So basically, we put ARS number, analytical reference number, which is the number there. Then we put other reference related to that, put together, put it there. So you do need to put everything there. Okay, you do need to have the name, class number, code number, batch number, expiration date, and the storage condition. For some volatiles, if you don't put it in the freezer, it won't stay. It will be gone. So, okay, you see the star, that means the GOP requirement. So you just need to check these boxes and you are fine. Okay, any questions so far? We have 10 minutes before I finish this in the box. Okay, there's no question there. Okay. Then, okay, here's the thing we talked about, the equipment. So when the inspection is going on there, so make sure your equipment, there's a SOP, an SOP for that specific equipment. Now, here's the question. What considered a major equipment? What consider the small, minor one? For example, LCM SMS, for sure you need something. GCMS, yes. How about HPLC? Yes, of course it's a major one. How about your balance? Yes, of course it is. How about the centrifuge? Now it's getting trickier because if it's a bigger one, you probably want to have it. And it's temperature controlled, for example. How about a tiny small one? How about a vortex? How about a shaker? So it's your decision and it's your scientific judgment, which one is the major, which one is the minor one. So if it is like a small shaker or vortex, I typically don't put it there. There's no need to have an SOP. That's fine, unless this vortex speed really affect your work. Then that's different. That's like a shaker. If you shake 60 resolution per minute versus 300, then you need an SOP. If not so important, just say 10 to set into maximum, 10 to set into middle, that should be fine. And the same thing as the stopwatch, okay? You grind your sample for 5 minutes, and is it Is it accurate enough? It's a 5 minutes, or it's not a 5 minute, 1 second, or it's not less than that. But in this case, that's not important because you get enough time. So it's your judgment call. So if it is a major piece, you do need to show people you have an SOP, and you do need to put it there how you clean that. Okay, how who is doing the maintenance, who is controlling. So every single piece, there is a responsible person. Okay, where it's location. So it should be specific place. You don't bring this everywhere. If it is small thing like pipetter, yeah, it's fine. But for the LCMS, I don't think you will need to carry this around every week. So no, unless it's portable equipment. Okay, then it's a good thing. Okay, and we'll say, okay, the maintenance here. Okay, you should have standardization and calibration. It should, okay, it says here, this is a GLP requirement. Look here. It should specify this is a routine and a non-routine. This is GLP requirement. Okay, this is not an option. You have to put it there because they can figure out what's really going on before and after, how your work is. And typically, for example, you do the routine cleanup or routine maintenance, preventive maintenance, your LCMS response will be double the peak. That's normal because you clean up the system. The ion source is much better. Everything's better. So, and a lot of times you change some parts, will do that. And that's routine because every like a year, the service engineer comes to do the work, which is fine. Then people will say, oh, you did this. How about I take the sample before? Oh, the area count is 1,000. After that is 2,000. And that's normal. But if you don't have the record to show that, there's a big question. Why yesterday your peak is 1,000, same concentration. Today is 2,000. So that's the explanations you need to explain why. Then it's not consistent. So yes, routine and routine is a must there. Okay. So, and all those SOPs are all related. And if something wrong with nature, the mother nature of this happens, you need to put it there. Because normally just put the routine, non-routine should be good enough. Okay. Then is it use some manual available there? So, nowadays, most of the manuals are electronic manual. So that's easier. Older days, it's the book. They put on the shelf there. Just after 10 years, you don't have enough room to put it there. So that's a good question. So nowadays, that's not a problem because you save the file on the local computer. So it always must have a logbook for specific for the instrument. So the log could be a couple of things. You can have 2 sessions or 2 different logbooks. One is for the use. Every time you use for the work, that's track how you do the work. One is for necessary maintenance. Something's going wrong. If you mix them together, it's very difficult to find out what's really going on. You say, today I ran 50 injections. Tomorrow I do the maintenance on the column. Then the day after, tomorrow I do more analysis. Like, okay, then later I change the septon. Then I do that. That's very difficult to do one by one. So it's better to have maintenance on the side on at least one session. Then you put all the activities on the instrument, the use log there. So it should be 2 sessions or 2 books, 2 logs for each instrument. Okay, we still have a few more minutes. Then talk about the test system. Then talk about the separation, limited access, tracking number. So I don't need to go through that. Okay, then go the lab issue. Do you have, okay, this one is always the question. So almost every single inspector will ask, where is your SOP book? Is it immediately available? So what in order to solve this problem, we always, each lab, we just print a whole copy, even though it's so big, put it there. And well, that consider another thing now, okay, which is how you control, SOP control. So once you do that, you have multiple, you have 5 labs there, you have 5 different copies. Then you have the original copy, you study director, then the study director may have a copy, QA may have a copy, the lab director may have a copy, so you have 10 copies everywhere. Sometimes each user may print a copy. So how you control that? Some places put the numbers there, some places just 1 people. I just go there, just grab everything once we have a new one. But you have to put in SOP, how you control your SOP book. Okay, let's just quickly go through that. Then SOP. There's a lot of SOP details about the how you do the work, the SOP in place. Then the next is personnel record. So personnel record typically for that part is your CV and your job description, your training. The rest of them should not be there. So it's a training records. Do you have GOP training? Do you have your science training, chemistry training? Do you have your education, your CV there, and your job description? What do you do? Okay, and that's it. So other things there, don't put it there. Okay. Okay. Then the facility. Okay, do you have EPA inspection? That part, it depends on the situation. Then archives. Okay. Okay, then quality assurance. Now this is a tricky one because when an inspector comes to any facility, normally you don't inspect the QA unless there's a reason. So you don't want to have QA findings there to affect what the inspector is doing the inspection. So this part is typically empty, depends on the situation, unless you have a reason. Then, okay, who is there? Write down all the names and what the findings are and the answers. So the study director or the lab director or even the field research director will respond. Okay, this is a response. This is QA finding. Okay, I think that's the time I need to say. I know it's a little bit too fast, too much content, but I think that's good enough for the time being. I will give you all those things later. I will either email, maybe I can email Michael. Michael can email you these files. I will try to maybe just make it 1 file or 2 files rather than just each individual small files. But anyways, you will get a copy of all the presentation plus this like a checklist or something for the training for you, so you later you can study on your own. Okay, yeah, that's almost the time. I know it's quite late in Asia now. Here is quite bright outside. Okay, any questions, anything before we leave? I leave like a 10-15 minutes for the question. You can type in the box. I know it's a little bit late, but that's okay. You can always email me. You know my email. My email is my last name, 2 letters of my first name, @msu.edu. Okay.
If there aren't any questions, I have a few comments, and certainly I'll let Wayne give his take on my comments and give his own. So for facility inspection, usually Wayne or I will come and do this for a new laboratory. So I just give you a hint on some of the things that I routinely find in a lot of the labs that I visit when I conduct a facility inspection. So some of the common things are use logs. For example, the balance. You have an SOP that for every time you weigh something, you will bracket the balance in relation to the sample weight and the log. You have a very nice log book, but the log book is not used. Or the other thing I often find is that there's no calibration standards next to the balance. Okay, so those are some common things. Temperature monitoring. A lot of times there's not continuous temperature monitoring. You need to keep files that are not actively used. They should be in archives. So a lot of times I find either there is no archive, or if there is an archive, the SOPs says that you should limit the access to archives. That's how you maintain the integrity of records. But the archive, a lot of time, is not locked. Same thing with freezers. You need to control access to samples. A lot of times we find that either there's no log on a freezer for removing and replacing samples, and a freezer is not locked, or there's no restriction on the access to that freezer. Wayne also went through on this report, or on this inspection checklist, I should say, about reagent solutions. A lot of times I find reagents and solutions not properly identified, no indication of concentration or expiration, or who prepared that particular solution. I find this very commonly on one of the instruments that you most commonly use, and the biggest, probably these days, probably the biggest user of solvents, which is the LC. On your LC, a lot of times the solvents that are mixed with acetic acid for the liquid phase of an LC, a lot of times there's not identification on all the solvents that you're using that are set up on your rack for use in the liquid phase of your LC. One other thing, we haven't worked this out yet, and I guess Wayne and I didn't discuss it, but hopefully we should be able to provide some kind of certificate of training for the lab training and also for the field training. And so one of the requirements for your personnel records is that you keep records of all the training. So when I go to a facility and provide training, I will provide a certificate. And then I will come back and I will inspect your records and say, show me the certificate that I provided to you from this training that we had last time. And a lot of times, oh, well, I brought it home. Oh, I stuck it somewhere in some other file. I don't know where it is. These things that I mentioned are some of the things that I commonly find. And so I just mention that that's a warning that you should be thinking about these things as you go through your own laboratory. Okay, Wayne?
Yeah, good point, Michael. Yeah. I think these are the commonly...
We have a question as well.
Oh, we do. Okay, let me check here. Yeah. One general query is necessary accredited laboratory pesticide residue? Is it true accredited lab result are more acceptable, reliable than other? Okay, on the first question, is it necessary to accredit the lab? The answer is yes. If you do certain work for the ISO, for something, it's better to have the accredited body to give you the accreditation and certification. For this specific study, we do GLP work. If you follow the EPA GLP, we do not require that. So it's better to have it. It's not required. The second question, is it true accredited lab results are more acceptable and reliable than other labs? The answer is yes. People will trust you, will rely on your results, and if it is GLP or even ISO, will be widely accepted by different companies, different agencies, especially the GLP. So if you put the GLP statement there, it's probably almost everywhere will accept the data. Yes. Okay.
Yeah, I'd like to follow up on some of those comments. So I agree in general what Wayne said. Some slight differences, I would say, if you're trying to generate data for JMPR technically does not require GLPs. If not, they certainly want to see ISO accreditation. So like Wayne said, it depends on what type of data you're trying to generate. Then for the second part, is it true that accredited lab results are more acceptable and reliable than other lab? Well, again, as far as accepted in the sense of, are you qualified to develop a certain type of data? I would say yes. As far as it being more reliable, in my opinion, no. The thing that determines the reliability is what you actually did during the study, not something, not a nice ISO plaque certificate that you have hanging on the wall. The thing that counts is what you do during that actual study. And that's really what GLPs are about. It's not simply having faith that you are accredited. It's how you're actually performing during a study. And it's that QA oversight and inspection and documentation, maintaining of those records.
Yeah, thanks, Michael. Agree.
Sure.
Okay, you can always send an email to Michael and me. So yeah, we can get back to you as soon as we can. Okay.
Yeah. And then more specifically for this project on the residue mitigation, we do not require ISO certification.
Okay. Good. Okay, it's quite late in Asia, so yeah, if there's no more question, probably we can stop here and we'll resume tomorrow same time. Okay.
All right.
Thank you.
Well, thank you very much, Wayne, for another great presentation. And we will have another one tomorrow, same time. You should all have the agenda. And if you have questions, please, you can send by email, or you can also send by chat tomorrow. If somehow there's somebody else that wants to join, please forward the link. We are okay as far as the number of people we have participating in these webinars, and then we are okay with you if there's somebody else in your laboratory or somebody in your group that wants to attend these presentations tomorrow. And we will, as Wayne mentioned, we will be sending out the presentations afterwards. Also like to thank the people from APARI. They're relatively silent here today, but many thanks to Sassy and Nui and and Cell for managing the IT. The thing that you know when they're working is when things are silent and nothing is going wrong.
That's good.
And that's been the case. So very much appreciated to all the folks there at Apari.
Thank you.
Any other comments, Wayne?
No, I think that's good. Yeah, good comments. Yeah, sorry I did not mention that. I should have.
All right. Well, if not, I think we have concluded today's session. I have a number of things. I'm not sure if I'm going to be able to be in all of tomorrow's session. So between Apari and Wayne, I think you are all in good hands, and I will see how much I can participate tomorrow. Thank you very much.
Thank you.
Bye-bye.